Hello, my name is Whitney Sambhariya, and I'm a 2024 to 2025 Capella Fellow, and this is my capstone project entitled National Institute of Health and National Eye Institute Funding: How to Advocate as a Trainee for Trainees. As a medical student, I was continually told about advocacy, but nobody really told me what it was or how to be a part of it. However, my day-to-day in medical school was spent studying, reading, and taking classes. I didn't know I had the ability to be involved in making a positive change in the medical field, let alone how to get started. It took me a few years to be able to fully grasp the depth and breadth of advocacy opportunities available to medical students, residents, fellows, scientists, and physicians. My advocacy journey brought me to the American Medical Association, where I was also able to therefore get involved in my own state medical society, as well as my subspecialty society for ophthalmology, AAO. I found a love for advocating specifically for trainees in their education and took a passion in NIH and NEI funding and how this is involved in creating our next generation of physician scientists. As a physician, we are continually working to advocate for our patients every day, and we have the unique capacity to understand the pathology of medical disease and treatment. The physician-patient relationship is one of privilege, and we are each in the unique position to encounter and work with others during some of their most vulnerable times. We see firsthand the social determinants of health, and by virtue of our medical training humanitarian mission, we've earned the trust of the public, and most of us understand what a privilege and great responsibility this is. Because we do really want to be there during these decisions that are going to affect the future of medicine, the future of healthcare, and the future of each of our patients. I personally would prefer to be at that table helping make those decisions that I know will affect that future. So the NEI, and why is it important? On August 16, 1968, President Lyndon B. Johnson signed legislation creating the National Eye Institute, or the NEI, which was established to protect and prolong the vision of the American people. And so the NEI today, the vast array of studied trials and others supported by the NEI has allowed for vision research in ophthalmology to progress over the past years. Currently, the NEI has over 1,600 active extramural grants running, as well as 23 laboratories of its own and 6 core facilities at their own site. This pie chart shows a breakdown of the areas of funded extramural research and just the vast array of things that are going on in the science and medical field. So what was I doing this year during this project to be able to support the NEI funding and the importance that it plays in training our future scientists? So I worked on writing and media participation. I participated in podcasts on NEI funding, as well as worked on writing opinion editorials on why NEI and NIH funding is so important for future physician scientists and their training, how these grants make it possible to create these future scientists and grow them in to someone who's going to make those scientific discoveries tomorrow. I also, as the new chair of ARVO, our Association of Research in Vision and Ophthalmology, Advocacy and Outreach Committee Chair, been working on our 50 States and 50 Stories project on the importance of science and medicine. This year, I was also able to go multiple times to Capitol Hill in order to talk with legislatures about the importance of funding and being able to support our trainees and their futures. I was also able to work with Neighbor Aber and their Emerging Vision Scientist program, where I went to Capitol Hill, was able to present my own research to legislators there, as well with many other scientists and young physicians. And finally, I was also able to participate in ARVO's annual Advocacy Day, where 43 members of our ARVO's Advocacy and Outreach Committee, as well as other parts of the organization, were able to go to Capitol Hill to discuss the importance of funding for vision research in ophthalmology. Finally, society advocacy. Through all of this and finding my own passion for working for funding for science and medicine, I've also found a passion for pushing other trainees to be involved as well and showing them that they too can find their own area of interest and be able to get involved. During this, I wrote a multitude of articles on how to get involved in advocacy, whether that's in your own subspecialty, your state, or even just your local community, and how all of those things can make such a large difference. Our trainees have the opportunity to become involved in advocacy at every level, and finding their passion and what they want to advocate for is just the first step. Volunteer for a state or national community to gain experience and mentorship. Find your passion, and together we are one profession, one voice, and together we can make a difference.